As we have discussed in the previous videos, we know that personality disorders have three clusters: cluster A, cluster B and cluster C. And today we'll be discussing about borderline personality disorder that comes under cluster B personality disorder. When we talk about borderline personality disorder, the main problem with them is unstable mood that can often change from joy to rage. They'll be terrified of abandonment in relationship, and also they'll be having difficulty regulating their emotions, impulsivity, self-harm, dissociative feelings, and even have psychotic episodes. Now let's check out the characteristics of borderline personality disorder or BPD. A pervasive pattern of instability of interpersonal relationships, self-image and affects, and is marked by impulsivity that begins in early adulthood and is indicated by 5 or more of the following. First, frantic efforts to avoid real or imagined abandonment that doesn't include in suicidal or self-mutilating behavior that is covered in criterion 5. Second, a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. Third, identity disturbance, that is persistent instability of self-image or sense of self. Fourth, impulsivity in at least 2 areas that are potentially self-damaging. It can be of spending money, sex, substance abuse, reckless driving, binge eating, but does not come under criterion 5 that includes suicidal or self-mutilating behavior. Fifth, recurrent suicidal behavior, gestures and threats or self-mutilating behavior. Sixth, affective instability due to a marked reactivity of mood, that is intense episodic dysphoria, irritability or anxiety, usually lasting a few hours or only rarely more than a few days. And seventh, chronic feelings of emptiness. Eighth, inappropriate intense anger or difficulty controlling anger, that is frequent displays of temper, constant anger or recurrent physical fights. Ninth, transient self-related paranoid ideations or severe dissociative symptoms. Now let's check out the prevalence or the epidemiological rate of borderline personality disorder. 1 to 2% of the general population is detected with BPD. Alcohol use disorder and substance abuse is found in first-degree relatives of persons with this disorder. And also, females are more likely to receive this diagnosis than the males. Moving on to the prognostic factor. Genetic factors. Some studies of twins in families suggest that personality disorders may be inherited or strongly associated with mental disorders among family members. Environmental factors. Many people with BPD have a history of childhood abuse, neglect and separation from caregivers or the loved ones. Brain abnormalities. Some research has shown changes in certain areas of the brain involved in emotion regulation, impulsivity and aggression. In addition, certain brain chemicals that help regulate mood, such as serotonin, may not function properly. Now let's talk about the development and cause of BPD. According to the DSM-5, BPD can be diagnosed as early as 12 years old if symptoms persist for at least 1 year. However, most diagnoses are made during the late adolescence or early adulthood. Most common cause of BPD is one of the chronic instability in early adulthood with episodes of serious affective and impulsive reactions leading to repeated use of emergency services at every crisis prior to BPD diagnosis. Almost 40% of people with BPD had been previously misdiagnosed with bipolar disorder. During their 30s and 40s, the majority of individuals with this disorder attain greater stability in their relations and vocational functioning. Follow-up studies of individuals identified through outpatient mental health clinics indicate that after about 10 years, as many as half of the individuals no longer have a pattern of behavior that meets full criteria for borderline personality disorder. Now let's check out the treatment for borderline personality disorder. Psychotherapy. Social skills training, especially with videotape playback, help patients to see how their actions affect others and thereby improve their interpersonal behavior. A reality-oriented approach is more effective than in-depth interpretations of the unconscious. Behavior therapy can be used for controlling patients' impulses and anger outbursts and help to reduce their sensitivity to criticism and rejection. For best results, pharmacotherapy has been added to the treatment regimen. So this was all about borderline personality disorder. If you like this video, don't forget to subscribe and share my video with your friends and dear ones. Hope to see you soon with the next video. Till then, take care. Bye.